Yeah, the next step will be collecting more data. While immune checkpoint inhibitor-related neurological adverse events might be infrequent, the increasing use of immune checkpoint inhibitors across many cancer types highlight the importance of healthcare providers recognizing various adverse events in the early stage, which can be severe and at times life-threatening. Earlier recognition of neurological complications can lead to earlier treatment, such as the use of immunosuppressants and cessation of immune checkpoint inhibitor use. The collection and analysis of additional post-market pharmacovigilance data is useful and necessary, but there are also limitations. In our studies using VERS database, we found approximately 3,000 cases with neurological complications. However, due to its self-reporting nature, acute, severe, or fatal adverse events may be over-reported, while transient, mild, or unrecognized adverse events could be underrepresented. Hypophysitis, for example, could present as non-specific symptoms such as headache and fatigue, making its diagnosis clinically challenging. In addition, while the VERS database is used regularly to evaluate safety concerns by the FDA, the database is limited by a lack of detailed clinical data. Therefore, possible confounding biases such as past medical history and dose and frequency of drug administration cannot be excluded. For example, higher doses of immune checkpoint inhibitors have been used in melanoma, and that might have led to the increased number of adverse events. In addition to data collection, I believe further studies on the mechanism of toxicities associated with immune checkpoint inhibitors is necessary. Several hypotheses are suggested as a potential etiology of neurological toxicities of immune checkpoint inhibitors, such as anti-neural autoimmune response precipitated by immunotherapy, a direct reaction to expressed antigen, and activation of pre-existing predisposition to autoimmunity. When looking back to AAN this year, there were more case reports and case series regarding the immune checkpoint inhibitor-related neurological complications, such as myopathy and encephalitis, or more infrequent complications. While the researches published so far have focused on relatively common complications, rare, undiagnosed complications will probably exist more frequently than we think. Gathering more data and accumulating knowledge on immune checkpoint inhibitor toxicity through basic and clinical researches would deepen our understanding on these complications in the emerging field of neuroimmunology and neuro-oncology.